Good afternoon, my name is Ashley Hatcher, and I'm going to be presenting a PowerPoint today about the opioid crisis. I'm a student at the Mississippi University for Women. At the end of this PowerPoint, I hope that you would be able to recall some information about the opioid crisis, the impacts it has on the economy, and the healthcare system as a whole. Be able to recall the signs and symptoms of opioid addiction in patients and healthcare professionals, and also ways to help combat the opioid crisis as healthcare professionals. That's just a little picture I have. It's all the different words that go with opioid crisis, and you can see some of the words of abuse, overdose, harmful, families, help, depression. All of those go with people who have opioid addiction. So what is the opioid crisis? The opioid crisis is an epidemic that is sweeping the U.S. A lot of people, millions of people are addicted to opioids, which are painkillers, whether it be IV form, which is like heroin or pain pills. It began in the late 1990s, and it has just escalated to a point where we're at a crisis now. It's at an all-time high for misuse and overdose. It began with the overprescription of opioid painkillers. And President Trump has declared this a public health emergency. Some statistics of opioid abuse and related deaths in the U.S. It's most common among uneducated, non-Hispanic white Americans, which is for a total of 80% of the U.S. population of those addicted to opioids. 21 to 29% of those patients are patients that have been prescribed opioids by their physician. According to the CDC, 47,600 opioid-related drug overdose deaths occurred in the U.S. in 2017. That's an outstanding number. Overdose deaths involving prescription opioids were 5 times higher in 2017 than in 1999. So how did this all begin? In the 1990s, guidelines called for better pain treatment and management by physicians, and pharmaceutical companies largely marketed opioids for pain management. These physicians prescribed opioids not only for post-op pain, but also for chronic pain conditions such as back and knee pain. Physicians faced backlash for not properly treating the new standards, so they felt pushed, so they started prescribing more and more pain medicine, and now we have more and more people addicted. Like I said, they were pressured to manage pain better. Instead of trying other forms of therapeutic pain management, they just forced pills down people's throats. Mass production and prescription of opioids began the downward spiral of opioid abuse. So what are the impacts of opioid abuse on the economy? We've had a large decline in the labor force participation again for working age Americans. Your people that range from 20s to 50s. This is your largest class of people who work, and these are the largest class of people that are affected by opioid abuse. Increased costs for Medicaid services and other government services. A lot of these people are addicted to opioids, so it affects them at their jobs. They may lose their jobs, and then they're forced to be on they're unemployed, they may be forced to be on Medicaid and other government services. Well, that costs money for the economy, plus you have a declined labor force. It's estimated at $800,000 per each overdose death in the U.S. Increased government costs for addiction and recovery treatments. You have more people that are requiring treatment that is offered to them by the government, and that costs the government money. Impacts of the opioid crisis on the healthcare system. We're having recurrent admissions. People that are addicted to opioids have a tendency to come back to the hospital because they're looking for the pain pills. They only get prescribed so many a month, and they're trying to, they come back for recurrent admissions. Frequent visits to the understaffed and overworked emergency departments place a strain. These patients constantly are coming through the ER because they're coming off their high. They may be going through DTs, and you're taking your nurses that are working in the ER, they're understaffed and overstrained, and you're taking them from patients that might need more attention, such as patients with strokes, heart issues, and we're having to treat patients that have these opioid addictions. More money is being spent on the patients with opioid addiction. Like I said, recurrent admissions, they're getting more government assistance, and that just costs more money. Rising insurance costs to balance money used for opioid addiction and treatments. And we know as healthcare professionals how much insurance has changed and how it has affected the hospital as a whole. And that they're starting to exhaust all medical resources. Signs of opioid abuse. Some of your classic signs are depression and anxiety, weight gain, an unkept appearance. They may have kind of pale skin. If they're actually on them at the time of their how, they may be very drowsy, have slurred speech, changes in personality where they used to be real calm and sweet with their families. Now they're, aggressive and lashing out at their family, which would also be mood swings. And here's just another picture. And this is just showing you they may have different cravings, which would cause the weight gain. They're more, craving sugar and sweets, poor performance at school or work. And, these are things to look for in your patients, but also you may work with some of these people. And these are just things that you could look for to help identify. And if you ever suspect that you have a coworker, you need to, seek out to someone in management and, let them look into that. They may have social isolation and loss of friendships. And like I said, signs of opioid use in healthcare professionals. They usually prefer to work alone. Maybe they take frequent trips to the bathroom. They have mood swings towards their patients and coworkers, it places a strain on the coworkers, but it's never acceptable to take out, aggression on the patient. Excessive tardiness or absences, underperformance, and weight gain. Ways to help combat the opioid crisis. Number one is education. Educate your patients. Also educate the people that you work with, the families. Provide consumers with information about the dangers of opioid addiction. These patients that are prescribed these medications, they need to have education about the dangers of what would happen if they get addicted, and stuff like that. Provide patients information about other forms of pain management. Therapeutic massages, physical therapy. There's other things other than pain medicine that you can do. There's nerve blocks. All of these things will help in your post-op patients. Training for healthcare workers to identify opioid abuse patients and how to treat these patients. Provide patients with treatment options and proper disposition of prescription opioid medications. And thank y'all for listening to my presentation.
Very good.
Thank you.